This is the month of August 2022, and we just completed 75 years of independence in India. As a fertility expert, when I think of freedom, obviously I think of freedom from infertility. And the more I think about it, the more I feel that freedom from infertility should not just mean being able to avail the option of IVF. Like good health should not mean the treatment of disease, but inherent good health. Yes, IVF is a wonderful option and has proven and given joy to millions of couples worldwide. But for us, fertility and freedom from infertility should mean how we can inherently increase our own reproductive potential and work towards a natural conception. And I am going to try and give you a few pointers towards how you can do this. First is awareness. I think it is very, very important for every couple, every woman, and every man for that matter to be aware that fertility is on the decline worldwide. It could be lifestyle, pollution, global warming, whatever the reasons could be, especially in the Indian ethnic population, especially women. We are seeing that fertility is increasing. Infertility is increasing, and the fertility potential is decreasing much more compared to their Caucasian counterparts. So, being aware of your own reproductive potential is the first step towards being able to take the next steps and good informed decisions on your path towards parenthood. The next step, the second step would be, what can I say? Healthy, healthy, healthy. I think being healthy and maintaining a healthy lifestyle is crucial, not only just for your own health, but also for your reproductive health. It is true that just being healthy does not mean that it will it will make sure that you will not get afflicted or not suffer from infertility. But yes, maintaining your health is going to decrease your risk factors towards something that might cause infertility, and hence making sure or that you take good diet, maintaining good exercise, having a good BMI, doing some kind of exercise and yoga, etc., is going to be very important. So make health a priority. Third, if you are married, it is important to discuss what your path towards parenthood means for both of you, for you and your spouse. So talk it out. You know what happens is that when you talk, when people get married and couples get married, people usually talk about family planning, and that usually just means using contraception to delay childbearing. But it should not be termed as family planning. It should be reproductive planning. One must decide when do you want to have children? What are your timelines? And do you have the choice and the ability to maintain those timelines? For example, if a woman has a low ovarian reserve, it might be more prudent for her to take advice and understand whether it might be actually helpful to proceed with a pregnancy earlier rather than delaying it for a very long time. So, talking it with your spouse and taking, the right understanding of your timelines is very important. Fourth, if you're not yet married, and this is especially for women who are maybe studying, maybe working, really concentrating on their careers, maybe have not found the right partner as of now. And if you think that there could be delay and a significant delay in your childbearing, think of whether you would want to freeze your eggs and your oocytes. This is a wonderful option for women today, and it has proven to give good results. This does not mean if you freeze your eggs, it does not mean that you will then have to only use IVF. If you freeze your eggs, you still have the option of going ahead and conceiving naturally whenever you want. But if the loss of time means that the reproductive potential has declined, having your oocytes preserved will give you the opportunity of using your own biological material even at a later point in time and then having your baby. So, this is one important point that one must consider. I think the fifth that I would like to outline is meet the right doctor and get the right guidance. So, this is extremely crucial. I have seen many couples, many women waste precious years because they have not found or received the right guidance. And here, especially in fertility, losing that precious time could mean losing the chance or ability of having your own biological child. If you can meet a fertility consultant, that would be wonderful. But even if you can talk to your own doctor, own gynecologist who you connect with and trust, that is also good. We have a lot of gynecologists who refer patients to us when they think that they need fertility treatment. Likewise, I have a lot of my patients who come to me for not only gynec issues, but for guidance of non gynec issues as well. Remember, the right doctor will know when to refer you when you need a specific specialist. But meet the right person and understand where you are, on that window or on that spectrum of your fertility. I think the sixth would be take time to kind of relax and reset and enrich your life, your thoughts. Many times in this habit of kind of doing more and more with life and wanting to provide everything for your child, so you kind of want to get ready, you might end up losing time. At the same time, if you continue to have a lifestyle which is very much filled with stress, it is going to increase your levels of anxiety, have physical symptoms, can affect your reproductive potential. It is also very important that, especially if you are thinking of having a baby, and if some of you are facing the problem of infertility, to try and reset your emotions and get out of feelings of guilt, shame, trying to keep yourself away from people, and find the right people to talk to connect, going out in nature, and enriching your whole life as a whole, because everything is a whole, like they say, it is even the word health, somewhere is rooted in whole. So everything is about a complete perspective about your life. So give yourself the time and the energy to just be, to enjoy life, to take a time out for meditation, going out for nature walks, spending time with family, enjoying good things, dance, music, spending time with your spouse. I think all these things are extremely crucial. And last but not the least, be open to embracing treatments when indicated. I think this is a very, very important point. What I have seen is many times that, in anxiety, sometimes we enter into treatments when they are not indicated. And likewise, out of fear, we also kind of fail to avail of treatments that would really help us, experience the joy of parenthood. So, definitely, if indicated, and if you feel right, and if your doctor so counsels you, do definitely take up treatments. Do not waste your time. But please understand that freedom from infertility should be how can you innately try and increase your own reproductive potential by doing things that enhance your life, your health, and your fertility. This is Dr. Mamta Dikhe, Director, Xenith Advanced Fertility Center in Pune. We are based in Wakad as well as Koregaon Park. Please do follow us on our YouTube channel as well as our Facebook and Twitter handle. Bye bye.